Hello everyone and welcome to Module 10, which is our final week of content. This week we are focusing on the topic of mental health. Now in your Cengage book there is not a chapter specifically for this. However, I would recommend you guys checking out the CMA test prep book, chapter 7. And reviewing the human behavior and professional communication. That chapter does go over different communication goals, the psychological stages of development, the psychological defense mechanisms, Maslow's hierarchy of needs, and the stages of death and dying. So all the things that we're going to be talking about in this PowerPoint and in this video are then again reviewed in that chapter, so definitely something you'll want to check out. So mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also helps to determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence all the way through your adulthood. Realizing that people are more than just physical beings, you must be able to care for the entire person in a holistic fashion. So with mental health, this will focus on the science of behavior and the human thought process or psychology. A psychologist is one who is trained in the methods of psychological analysis, therapy, and research, where a psychiatrist is a medical doctor who has chosen to specialize in the psychiatric field and can prescribe medications. Psychiatry is a branch of medicine that deals with the diagnosis, treatment, and prevention of mental disorders. Regardless of what branch the provider is in, within the study of psychology, a distinction is made between what is normal and what is abnormal behavior. So what I want to do is spend some time discussing some different psychological disorders to help you understand them. So psychological disorders are disorders that can result from genetic abnormalities, infections, nutritional deficits, brain defects or injuries, or substance abuse. Mental disorders are defined as any behavior or emotional state that causes an individual great suffering or worry, is self-defeating or self-destructive, or disrupts a person's day-to-day relationships. The first two I want to talk about are going to be anxiety disorders and cognitive disorders. Anxiety disorders are emotional disturbances that impair judgment. Those suffering from this disorder are able to tell the difference between fantasy and reality, but frequently experience vague feelings of apprehension, worry, uneasiness, or dread. The fear can actually prevent people from seeking the help that is needed or the treatment that is needed, and can impair their overall health. Cognitive disorders are a type of disorder that includes delirium and dementia and can impair the ability to think clearly. Delirium can be transient and is usually treated by easing a person into a withdrawal from a substance or by treating the underlying cause. Dementia is something that has been previously discussed in earlier chapters, so I'm not really going to discuss that here. But if you need to review that, you absolutely can. Then we have developmental delays and dissociative disorders. Developmental delays will appear before age 18. Things such as Down syndrome could be seen as a developmental delay. Mental retardation is a broad term that is used to identify individuals who are profoundly unable to function in the world, and those who have relatively high intelligence but are slow to learn. For example, autism also falls under a developmental delay. This has a range of symptoms that generally include difficulties with communication and forming relationships. With these disorders, as a medical assistant, you need to work with both the caregiver and the patient. Dissociative disorders will cause a person to withdraw from reality and dissociate or separate themselves from life issues that give them anxiety. Amnesia also falls under this type of disorder because they will often forget events, places, or even their own identity. Dissociative identity disorder, or DID, which was formerly called multiple personality disorders, is a severe dissociative disorder where a person can develop multiple personalities. If you've ever seen the movie Sybil, or if you've seen the one that most recently came out, Split, that talks about people having DID, or dissociative identity disorder. This is typically due to an individual experiencing a severe victimization, and they have developed personalities as a defense mechanism to protect themselves. We also have eating disorders and hypochondria. Eating disorders could be anorexia or bulimia. They are emotional disorders that affect the primarily young women, and they develop a distorted self-image. This disorder, or these disorders, can be life-threatening and cause permanent damage to a patient. So if you start to see any signs of symptoms of an eating disorder, you need to report that to a provider immediately. Hypochondria is a disorder in which a person is preoccupied by fear or fears of contracting a serious disease. It's based on a misinterpretation of one or more bodily symptoms and signs. We also have impulse disorders and mood disorders. Impulse disorders are a prime example of this would be somebody with ADHD. It's a disorder of impulse control that affects many children and can persist into adulthood. Mood disorders are disorders of the emotions or feelings that often include persuasively negative worldviews. So, for example, somebody with bipolar is a prime example of where the patient experiences two poles, mania and depression. Mania is excessive energy, flights of ideas, enthusiasm, weight loss, or lack of cognitive focus, where depression is a lack of enjoyment in life's usual pleasures such as food, sex, friends, family, and hobbies, and it can be life-threatening when accompanied by suicidal thoughts. Personality disorders and psychotic disorders are the next two, along with substance abuse. Personality disorders include narcissistic or self-centered, paranoid, or abnormally concerned about what other people will do to them, antisocial behavior, which is not concerned about the laws or other people, dramatic behaviors, or borderline or impulsive behaviors. Psychotic disorders are severe mental disorders that interfere with an individual's perception of reality and their ability to cope with the demands of daily living. Schizophrenia will fall under this category, and that is a psychotic disorder that is marked by a variety of symptoms, including delusions, hallucinations, disorganization, and incoherent speech, severe emotional abnormalities, and withdrawal into an inner world. Substance abuse is typically what we would call addiction. It's a psychological need for a substance that in its absence causes withdrawal symptoms. When a patient depends on a substance instead of a family or friends to cope with problems, the patient is considered dependent on that substance. Treatment usually begins with the patient admitting that they have a substance control problem and controlling them, and they recognize that they need help. From there, the patient is accountable to a group that the medical assistant can help to set up. So now that we've talked about all these different disorders, how do we treat them? So treatment for mental disorders are varied and can include psychotherapy, psychopharmacology, electric convulsive therapy, and transcranial magnet stimulation. I'm going to let you guys read up on those a little bit more, as I have some other things that I really want to talk about in this video before I close it down. I want to talk about the developmental stages of the life cycle. You, as the medical assistant, will provide appropriate care for your patients, and you need to make sure that you do it in every stage of life. There are 5 main stages of life and life periods. We have your prenatal period, which is the first period of child development and covers conception through birth. Infancy, which is the second period and the period of vast changes that occur from childhood through toddlerhood. Childhood is the last period of child development. We have early childhood, which is ages 3 to 5, and middle childhood, which is ages 6 to 11. Then we go into adolescence. This occurs between childhood and adulthood. And again, we have early adolescence, which is ages 12 to 14, and late adolescence, which is ages 15 to 19. And then we have adulthood. And this can be divided into early, middle, and late childhood. Early adulthood occurs when a person is in their 20s to 30s. Middle adulthood occurs when they're in their 40s to 50s. And late adulthood occurs from 60 to death. Each of these stages and age groups, you will see different challenges. And I'm going to leave that again for you to read because it's good for you guys to kind of get to know those different stages. Lastly, we're going to talk about Maslow's hierarchy of needs. This means that people have special needs and moved through various levels in achieving satisfaction in their life. There are 5 elements or levels to Maslow's hierarchy of needs. First level is the physical need for food, water, and shelter. So those psychological things that we need to survive. Level 2 is security and safety. This will include the physical safety as well as security in relating to employment. It'll also go into, having a home, a secure home that you feel confident and safe in. Level 3 is the love and social needs. This will include having a sense of belonging to a group and the need for social interactions. Feeling that deeper connection to something or having a meaningful relationship. Level 4, self-esteem and status. This will mean you have a sense of self-worth and a sense of pride. You like to feel like you are needed, you like to feel like you are wanted, and you like to feel like what you're doing is appropriate. And then finally, self-actualization or self-fulfillment is the final stage. This occurs when the individual achieves all that he or she is capable of achieving and experiences a sense of accomplishment. You're living to your highest potential. All right, guys, that's what I've got for Module 10. We'll do some in-class activities with mental health and getting you to understand what your role in mental health really would be. But we'll also be spending some time getting ready for final exams and again, finishing up any externship things that we need to as you prepare to head into externship next quarter. If you have any questions, please make sure that you do bring them to class. Otherwise, I will see everyone on Tuesday morning. Bye, everybody.